Hello guys, welcome to our channel. Today we will be discussing the anesthesia rapid revision as part of our Mission 200 plus for the upcoming examination of the June 2026 guys. So let's start the discussion. Anesthesia is one of the most important subject you all know because it will be only 5 questions, but the 5 questions can boost you because 150 is our target. So 5 questions might help you, and this is an easy subject. You can just listen this chapter, listen this video and then just practice the Q bank. That is enough for the examination. Okay, so don't forget that to do, and also practice the Q bank. So let's start the discussion guys. Whoever is new to this channel, please do subscribe and share with your friends, and do like the video so that it will reach the many students who are preparing for the upcoming examination. So let's start the session guys. So today we will be discussing the anesthesia. In the anesthesia, the first and foremost important points such as who is the most common person who has discovered the anesthesia, because imagine without the anesthesia how dangerous, how traumatic is the surgery, right? So it has happened even in the history also. There are the times that the surgery has happened without the anesthesia, right? But thanks to the John Snow, he is the first person who has done the research of the anesthesia. Okay, so thanks to the this person, his name is John Snow. Okay, John Snow. And coming to the another person here, you can see he is Malampati. Okay, so Malampati was discovered by the Malampati scoring for the airway management. He is actually described by the Malampati himself. He is from India, and this is the Malampati scoring is one of the best scoring and used by the all over the world. Okay, not just India, it is all over the world. And but the greatness is he is from the Telugu state and also from our India. Okay, so let's start the session. So first and foremost important thing, you have to differentiate the grading. Okay, so for that we have the separate grading system, that is the ASA grading. Okay, ASA grading is also asked many times in the examination. So let's see one by one. What is the first person ASA grading for the first ASA grading one? So that means you and me. Okay, so normal person, he has no history of the disease, he has not taking any kind of the treatment, and patient is non-smoker. Patient is non-smoker. Next, ASA 2, that the patient is have the disease, okay, but no limitations, he has been on medications and no limitations. And there is a question that has been asked, pregnancy will come under which criteria? Pregnancy will come under the ASA 2. Why? Because pregnancy will be associated with the many physiological changes, right? That is, even though it is a physiological changes as per the pregnancy but not as per the normal human body, so that's why pregnancy is belongs to the ASA 2 grading, right? Next, the ASA 3 grading is the patient is having the disease, but there is a limitations. Okay, so there is a patient which will be having the limitations for this patient, or the patient is not compliant recent days to the medications, or the patient is having the stunt procedure less than 6 months. Okay, and recent MI attack, all this will be considered as a ASA 3 grading, or the patient is on the different kinds of the seizure medications. Next, ASA 4 grading, this is the severe. Okay, the patient is severe condition and significant, the patient is having the life threat to his life. Okay, so that complications are life threatening for the patient. Next, ASA 5 patient. ASA 5 patient is the moribund patient. Moribund patient means whether you do the surgery or whether you do not do the surgery, the patient will die. That is what moribund surgery, moribund patient. Next, ASA 6 grading, this is for the brain dead patient. This is to brain dead patient. Whenever you are going for the transplantation, there is a person that is going to declare the brain dead, that is done by the intensivist or the anesthesiologist. Okay, that is for the this one. Next, we will be talking about the what is daycare surgery. Nowadays, the daycare surgery related questions has been asking. What is mean by the daycare surgery? So daycare surgery is famous in the Western countries nowadays, in the Indian settings also, in the corporate hospitals, especially in the metropolitan cities. This daycare surgery is common. So what is mean by the daycare surgery? So we will be taking the only the mild surgeries, mild surgeries, and then after that the surgery should be less than 90 minutes. Okay, surgery should be less than 90 minutes, and mostly it can be minimally invasive surgery procedures is better comparing to the open surgeries, and the patient can be discharged within the 24 hours. And how we are going to discharge this patient? For the discharge of this patient we will be using the specific score, and the scoring is known as a modified Alderate scoring. So modified Alderate scoring, if ever they're having more than 9, we can discharge this patient. And what is the criteria for the daycare surgery? The patient must be landing in between ASA 1 or the ASA 2 grading, right? That is one. And next, which are not admitted, especially the newborns, okay, infants who has any diseases, and also more than 85 years. We are not going to admit these patients. Next, what are the drugs is used for the daycare surgery? So the drugs that is commonly used, if you take the IV drugs, the IV drug that is used is the propofol, common drug. Okay, what is the most common daycare drug? Also, you can answer that is propofol. And if they say what is the opioid that is taken, opioid is the ramifentanil. And why the ramifentanil is preferred? Because it is a cardiostable drug. That is a cardiostable drug. And inhalation drug, if we take, that is a sevoflurane. Even for the children, like sevoflurane is good for the children also, that's why we will be using the sevoflurane. Next, what can be done for the other one? That is a muscle relaxants. For the muscle relaxants you can use the rocuronium can be also used for this patients. These are the some of the criteria, what these are the some of the drugs that is used in the daycare purposes. So daycare purposes surgery also, or the way the other surgery also, we have to follow the PAC. What is meant by the PAC? Pre-anesthetic checkup, right? Just like this grading is also done in the pre-anesthetic checkup only. So first in the foremost, the important thing, you have to take the history, you have to do the physical examination, you have to do the systemic examination. If needed, the patient should be go for the ECG, if needed echo, and also important serology test, okay, especially the viral markers for the patients, and also CBC and platelet. All this will be important for the patient. And if ever the patient is having any other diseases, then in the serology only we will be including the electrolytes, LFT and the KFT. This is the basic structure that has to be fulfilled for the patient. For example, let's say that the patient is on the disease. So the deceased patient must be taking the different drugs, and how these drugs are used before the surgery, when we are going to start or the stop these drugs. Okay, first this is the drug, and stop when to stop, or let's say continue. So the first and foremost, all the hypertensive drugs can be continued. Okay, without the delay you can continue these drugs, excepts are most important. For example, ACE inhibitors or the ERBs. These drugs are stopped on day of surgery. Okay, these are stopped on the day of surgery. Next, diabetes mellitus, oral hypoglycemics or the ultra short acting insulins. These are also continued. I'm sorry, these are stopped. These drugs are stopped on day of surgery. But another exception, SGLT2. These SGLT2 inhibitors that is stopped prior to the 72 hours of the surgery. Okay, prior to the 72 hours of the surgery, you have to stop. Right? As I said, exception is very important. Coming to the thyroid drugs and steroid drugs, epilepsy drugs, epileptic drugs, and also psychiatric drugs like schizophrenia drugs. All these are continued regardless of the patient. This has to be continued, these drugs. Okay, next, coming to the MAO inhibitors. Okay, MAO inhibitors are associated with increased hypertension. So that's why we will be avoiding at least 3 weeks gap for the drugs. 3 weeks gap, this has to be stopped. Before the 3 weeks only you have to stop. Next, OCPs, oral contraceptive pills. If the oral contraceptive pills is also stopped at least 4 weeks prior, because they are increased risk with the DVT. This is priorly, guys, before the surgery. For example, mostly elective surgeries we have to stop. Next, coming to the another important, this is question is asked directly. They didn't mention the anti-tubercular drugs. They must have mentioned the pyrazinamide, ethambutol. These drugs can be continued. Drugs can be continued without any delay. Next, most important one, that is the thiazides. Thiazides can damage the patients like irreversibly also sometimes because of the fluid that the diuresis which will be caused by these drugs. So all the thiazides can be used, continued, except remaining all the drugs. Okay, remaining all renal drugs has to be stopped. Okay, has to be stopped on the day of surgery. Next important points, that is the anticoagulants, warfarin. Okay, warfarin is stopped 5 days before the surgery, same as a clopidogrel. Clopidogrel is also stopped 5 days before. And aspirin, if it is a low dose, we can continue, and if it is a high dose, we have to stop on day of surgery. Right, these are the important points that you have to remember. Next, how about NPO, nothing per oral? Nothing per oral, especially in the adult patients, 8 to 6 hours prior to the surgery, that is important. Okay, 8 to 6 hours. Next, this is for the solids. This is for the solids. What about the liquids? Liquids is at least 2 hours, but the children is not like that, right? In the children it is different. For the children, 4 hours for the breast milk, 4 hours for the breast milk to prevent the aspiration, right? Next, semi solids, like at least 3 to 4 hours. Okay, let's say 3 hours, 3 hours for the semi solids, and again 6 hours for the solids. This is for the children. NPO is also very important. Next, coming to the prophylaxis. What are the prophylaxis that we will be giving for these patients? In the prophylaxis, you have to give the antibiotics. Antibiotics is given at least 60 minutes prior to the incision, right? And hair removal is done on day of surgery only, on day of the surgery, using what, guys? Not the razor that is used with the help of hair clips, right? And also, as a prophylactic, we can give the odonsetron. Okay, odonsetron. This is given as a prophylactic dose, especially for the female patient, and rarely the aspiration that drugs are given, right? These are the important points that you have to take note whenever the pre-anesthesia checkup is important. Next, moving on to the high flow devices. Next, moving on to the high flow devices. So these high flow devices are known as cylinders, right? Gas cylinders. And in this gas cylinders, you have to recognize by the color. For the oxygen, it is the black body and the white shoulder. Next, carbon dioxide, it is the gray body and gray shoulders. N2O, this is completely blue color, and helium, this is for the brown color, and nitrogen, it is black color, and only air, that will be white body with a black shoulder. Next, cycloprene, that is for the orange. Entonox will be the white color shoulder and the blue color body. So okay, these points is also important. Next, coming to the important point that you have to remember is the pinpoint index. Okay, so the pinpoint index can be also asked in the examination. So what is this pinpoint index, guys? So pinpoint index is having the different kinds. So pinpoint index is different from the everything. For example, let's take air, oxygen, nitrogen. So to prevent the wrong connections, okay, to prevent the wrong connection between each other, we have to use this pin index. Everything will be having the specific. For example, let's say air, remember this way only so that you cannot forget in the examination. 5, 5 and 5. Okay, this is for the air, oxygen and the nitrogen. Next, CO2 less than 75%, I mean 7.5%, and CO2 more than 7.5%, and this will be with the 1, this will be with the 1 and 2. Okay, 1 and 2, 6 and 6. Okay, so this is how you can remember for the CO2. Next, the last one, that is the entonox. This will be consisting of the 7, and entonox formation is 50% of the oxygen and another 50% is the N2O. This will be 50 is to 50 classification for the pinpoint index. Next, coming to the neuromuscular monitoring, right? This is the neuromuscular monitoring. This question with the image based question is asked in the examination. Neuromuscular monitoring. So with the with this importance of the neuromuscular monitoring, why we are actually looking for the neuromuscular monitoring? So this neuromuscular monitoring will help us to know the how much is the muscle relaxation or the muscle contraction is taking place in the anesthesia, during the anesthesia. So this will check for the train of 4 stimulation of the muscles, train of 4 stimulation of the muscles relaxation. And what is the most common nerve that is taken as an example? Ulnar nerve. And what is the most common muscle that is taken? That is adductor pollicis. Adductor pollicis. And what happens in the depolarizing agents? In the depolarizing agents, the height will be decreased. Non-depolarizing agents, this will be decreased over the time. Okay, decrease over the time, that will be seen, for example, like this. And for this is normal, this is the depolarizing agents. Okay, so the slope will be decreased like this. This is for the neuromuscular monitoring. Next, moving on to the Mapleson system. The Mapleson system is the semi-closed system. Okay, semi-closed system. What is the benefits of the Mapleson system? So benefits, if you say the Mapleson system is easy accessibility for the patient, and there is no that the any patient cannot be discontinued immediately. Like sometimes what happens, the chances of the disconnection will be seen, but these semi-solid Mapleson systems are highly connected and very secure in the airway management, but they have the disadvantages. What is the disadvantages, guys? The disadvantages that they have is that it is large gas flow that is present here. Okay, so that is the first one of the most important point that you have to know. Next, we have the different types of the Mapleson systems. This is the Mapleson A, and this is the Mapleson B, this is Mapleson C and D, E and F, right? Only the important points that you have to take note. What are the different names and what is the uses? So A is most commonly used in the adults. A is used in the most commonly adults. And this is other name is also you have to know. This is the Magill circuit. This is the Magill circuit. And what is the importance of the A? The A is important for the spontaneous breathing. This is used for the spontaneous breathing. Next, just beside that, we have the D. D is used with the help of the Baines circuit. B is used for the help of the Baines circuit, and this is also commonly used for the patients. And this will be giving us the controlled ventilation. This will be give us the controlled ventilation. Next, F for the children. F is used for the children, and the other name for this is the Jackness circuit. Okay, Jackness or the Jackson circuit, and this is commonly used for the children or the pediatric population. right? These are the important points that you have to take note. And the Mapleson E, which is also known as a Ayers T, Ayers T piece, Ayers T piece, because you cannot see the bag here. So the bag is not presented, that is seen with the Mapleson E, right? These are the important points that you have to take note for this particular thing, guys, right? Next, moving on to the another important topic, that is the capnography. We are just still in the pre-anesthetic only. Okay, so once we enter this anesthesia topic, when we are in the surgical room, we have to monitor the capnography. Okay, what is the capnography? Capnography means graphical representation of the end tidal CO2. The end tidal, whatever the expression is going from our body, that is how we are monitoring here. So there are the different phases. This is the phase 1, and this is the phase 2, phase 3, phase 4, and again phase 1. So phase 1 and the phase 1 is a plateau. Why the phase 1 is in the baseline? Because this is for the inspiratory. This is for the inspiratory, and the baseline, that is not going to be touched. That is the first point that you have to remember. And what are these different phases? As I said, phase 1 is for the inspiration. Phase 1 is for the inspiration. Phase 2 is for the expiration. Expiration early stage like upstroke, and here the dead space is mixed. Dead space is mixed where? That is in the phase 2. And this is the plateau phase. This is for the plateau phase, and all the alveoli mixing will be seen in the plateau phase. And the phase 0 or the phase 4, we can say this is the expiration downstroke. That means our expiration is already done and we are having the inspiration, that is seen with the phase 0. And the different types of the graphs may be asked in the examination, that you have to remember. And how the normal wave will be looking, guys? The normal wave form will be looking like this. At least 3 spontaneous graphs will be seen in the normal waveform. Next, obstruction. Obstruction may be due to bronchospasm, most commonly with the bronchospasms. And in the bronchospasms, if you can observe, this will look like a shark fin appearances. This will be looking like a shark fin pattern of the thing. Next, another type, we have the leak, that is due to the air leak, especially with the problem with the ET tube. ET tube connection, we will be seeing that the, if you see, the plateau is completely compromised, that is seen with the leak. Next, third one, apnea or the disconnection. So as I said, there should be 3 at least. So something that is not, probably the graphical representation is not coming, so might be the disconnection is happened. Next, cardiopulmonary arrest. What happens? There will be decreased waveforms. Next, rebreathing. If ever the patient is having the rebreathing, that means a spontaneous rebreathing, so there will be gap between the two, and also there will be no baseline touching. If you observe, there is no baseline touching, the patient is recovering. This is for the signal for the extubation. That is one point that you have to remember. Next, what is the graph? What is the monitoring that is happening in this patient? This monitoring known as a bispectral index monitoring. This is known as a bispectral index monitoring. With the help of what waves we are looking here? With the help of the EEG we are looking here. So this will be given as a scoring. For example, 0, let's say 40, then 100. So 100 means the patient is highly aware what is happening. So 0 means the patient is unaware. So why we are actually looking? We are looking for the what is the depth of the anesthesia. So this is about the depth of the anesthesia. So as I said, remember in the past days, without the anesthesia we used to amputate. So how traumatic. Even now also, whenever you are giving the anesthesia also, it's still traumatic for the patient. So to avoid that, we have creating the amnesia in the patient. So we will be maintaining this depth around the 40. Okay, 40 we will be maintaining for the patient. Next, some questions may be asked with the different types of the gauges also, right? In the Fmge, this can be asked in the commonly. And how can you remember, guys? Just remember from the bottom of the earth, there is a mnemonic, that is the bottom of the earth, lava. Okay, just below the soil there will be lava, above that, that is the soil, and soil will grow the grass, and eventually the grass, small grass, sometimes it will be giving the flowers, and flowers after we will be seeing the sky, and then we will be having the sun, right? That will be the pattern. If you see, this is from the down to upward. Next, coming to the what is the colors, the coding that will be given. This is orange, lava will be in the orange color, and the soil will be in the gray color. Okay, grass will be in the green color, flowers is in the pink color, and sky is blue color, and sun is in the yellow color. And what is the numbering that is given for them? So the numbering will be, so starting with the 14 increase, there will be 2 gap, 18, 20, 22, and this is the 24, right? These are the important points that you have to remember. This is used for the pediatric population commonly. This is used for the blood transfusion, and the pink is used for the adults, right? This is the important point that you have to remember. What is this number, guys? This is the gauge number, right? This is the also one point that you have to remember. Next, some of the other important points. If you monitor the temperature, where is the best way that you can monitor this temperature? So best is site is the lower esophagus. Lower esophagus is the best. But in the patients who are undergoing the cardiac surgeries, for them you can use the pulmonary wedge pressure. There is a separate, that is a catheter will be presented. With the help of that you can use this one, pulmonary wedge pressure device you can use. But the pulmonary wedge pressure is associated with the complication, that is the pulmonary artery rupture, or the patient can also have the pneumothorax. Okay, this question can be also asked, guys. Next, moving on to the airway management. Airway management is also commonly asked questions. So let's say, for example, I had a patient. So we had a patient. The patient is actually, the breathing is present. The patient is having the breathing is present, and the patient is pulse is also present, but the patient is having the loss of consciousness. So in this situation, what you can do? So maximum you have to call the emergency department. After that, you have to put the patient on the left lateral position. Okay, left lateral position until the emergency department will be arriving. You keep checking the pulse and keep checking the respiration. If ever it is not decreased, then we will be proceeding that way. Next, Malampati scoring. Malampati scoring, just I said, the Malampati was the discovery that is done by the Indian doctor from the from the Andhra Pradesh, and he has contributed one of the best inventions of the Malampati for the endotracheal tube intubation. So what is this grading, guys? In the endotracheal intubation, we are actually looking whether the patient is fit to go for the endotracheal intubation without wasting time compromising the airway, or we can proceed for the other procedures, right? So the class 1 people are normal. These are the important class 1 people will be and normal. You can see the uvula here. You can see the tonsillar pillars and also hard palate and also soft palate. All will be visible in the patients of the class 1. We can consider these patients as a normal. And in the patients of the Class 2. Class 2, the tonsils are not seen here. Uvula is seen. Soft palate, hard palate is seen, and also soft palate is also seen. In the class 3, there is a obstruction of the tonsillar pillars. We cannot see, and only visible is the uvula base, right? The tip of the uvula is also not seen here, and soft palate is seen, and also hard palate is also seen here. And in the class 4 patients, only the hard palate is seen. Soft palate is not seen, uvula is completely obstructed, and tonsils is also obstructed. And which is best case? This is the best. Okay, this can be done. Okay, this can be done, good prognosis, but these three are absolutely avoided as they are bad prognosis in the patients. Next, another airway. If ever you see the patient is having the breathing problem, what can be done? So this is known as a treble maneuver. This is known as a treble maneuver. So what we will be doing in the treble maneuver? First, there will be head tilt, and chin upward, and jaw thrust. Okay, so head tilt, chin lift, and jaw thrust. That should be done. This is known as a treble maneuver that we are going to do in the patients. Next, another types of the airways that we commonly use in the hospitals. So this is, you all know, this is a nasal cannula, right? This is a nasal cannula, and this is the oxygen mask. and here this is the oxygen mask with the bag, right? This is the oxygen mask with the bag. And the questions that can be asked, what is the oxygen flow rate? What is the oxygen flow rate? So for the nasal cannula, it is 6 liters. At least it is going to be the 6 liters. From the 2 liters to the maximum is the 6 liters of the O2. Maximum of the 6 liters of the O2. And coming to the here O2 mask, this will be consisting of the 10 liters, 10 liters of the O2 maximum, I'm telling. Okay, and this one will be 15 liters of the oxygen, 15 liters of the oxygen. And how about the F5O2? How much we can achieve? So F5O2, this can be achieved for the 0.24 to 0.45. Okay, next coming to here, the F5O2 of the O2 mask will be somewhat increased, 0.44 to 0.60, and the bag can be increased even more. Okay, the bag will be increased even more, 0.60 to 0.90%. That will be increased in the rebreathing mask. Okay, bag. Next, coming to the laryngeal, this is the laryngeal mask. Okay, laryngeal airway. So laryngeal airway is done in the patients those who are not fit for the intubations sometimes. But what is the importance of the laryngeal airways? So this is a classical type. This is the classical first generation. This is the second generation ProSeal type. So the difference here is the one tube, and this has the two tubes. This is have the two tubes. So this is associated with the risk of aspiration, first generation, and this will be decreased with the risk of aspiration. Okay, this is the decrease the risk of aspiration. That is the first thing that you have to remember in these patients. And especially in the pregnancy, okay, in the pregnancy, this is contraindicated. What we can use in the pregnancy, that is the eye gel type. Eye gel is used, but LMA is contraindicated. LMA is contraindicated. Next, here you can see this is the endotracheal tube. So in the endotracheal tube, so some of the endotracheal tubes, we don't see the cuff. But if you see the cuff, what is the importance of the cuff? Nowadays we use the cuff only. The cuff is having the importance because it will prevent the aspiration. Okay, so for the prevention of the aspiration, that is important. The most of the times we have to use the endotracheal tube with the intubation. For the ET intubation is cuffed only. Okay, next here you can see this is the types of the larynges. Okay, laryngoscopes. So this is used for the adults, this is used for the adults, and this is used for the pediatric patients. So what is the differences for the pediatrics patient? This is more curved, this is more straight. That is the differences. And what is the names? Names can be also asked. This is Macintosh. You might have seen in your hospital rotations. And this is straight. This is known as a Miller. This is known as a Miller. And what is the hand that you are going to use while you are inserting? You have to use the left side of your hand. And what is the side of the patient that you have to stand? Right side of the patient you have to stand, right? This is the 2 points also that you have to remember. And what is this you are looking here? This is the Goodell's airway. This is for the Goodell's airway, and to prevent the tongue fall, we will be using the Goodell's airway, which will be having the different sizes. And what is this mask? This is the high flow meter. This is the high flow meters, more than 15 liters, more than 15 liters if you want to give. And the FiO2 of this one will be 0.24 to 0.60, 0.24 to 0.60, and the name that is known as a Venturi mask. This is name is known as a Venturi mask. And last year or by last year, there is a question that is asked directly from the ventilator forms. You have to identify. So the ventilator forms here, you can see the first we will be looking of the pressure and the flow, and also how much volume that we are giving. So this will be the volume that will be looking at the tidal value, and the tidal volume should be less than 6 ml. That 6 ml per kg the patient should be getting, and the peak inspiratory flow that should be increased. Okay, always remember the peak inspiratory flow should be increased in the patients. And the last one we will be looking at the pressure. In the pressures we will be looking at the alveolar pressure. Okay, so this phase is known as a alveolar pressure that we have to take note whenever you see. And also PEEP, So the last one, the between this, the PEEP, the positive expiratory pressure is also increased, right? These are the patterns that you have to check. And if they given in this form also, you have to identify this is for the pressure, this is for the volume, and this is for the volume of the thoracic cavity, right? Again, this is the tidal volume, this is for the positive pressure, right? Here you can see this is the peak inspiratory flow, and this is for the PEEP, right? This identification should not be missed. And last, this is a very rarely asked, especially in the NEET PG, it is asked commonly, guys. This is known as a Cormack-Lehens scale. Cormack-Lehens scale is looking at the glottis opening. So this is for the normal patients. In the normal patients, the glottis and the epiglottis is absolutely clearly looking. Here in the grade 2, it is abnormal, especially the posterior surface is more prominent, and the grade 3, only the epiglottis is looking. Okay, and grade 4, the epiglottis is not looking, and glottis is completely closed. Here also, the glottis is completely closed. Only the best prognosis will be associated with the grade 1 type. Okay, the grade 1 type only will be having the absolutely the best prognosis that we can see in this patients. Okay. Next, moving on to the anesthesia. What is the importance of the anesthesia and the different drugs, different types of the drugs that you have to know about? So whenever we say anesthesia, anesthesia is playing the major role in the loss of consciousness. That means general unconsciousness. Don't say this is the loss of consciousness. We can call other name. This is the general unconsciousness. The patient is having the general unconsciousness. And along with that, another goal is that we are actually getting the analgesia, right? So the pain will be decreasing, and also patient is unaware of what is happening around the patient. That is also one of the important point that you have to take note, right? This is the two important points that is plays the major role in the anesthesia principles. And next we will be discussing about the different types of the drugs. So first we will be discussing of the IV agents. Okay, IV agents we will be taking note. So in the IV agents, I will be first discussing about the barbiturates. In the barbiturates, the older one, that is the thiopentone. The drug is the thiopentone. So thiopentone, if you want to know this thiopentone is a barbiturates. This is a barbiturate drug. Okay, and these barbiturate drug is only the onset is 15 seconds. This will be having the onset of the just 15 seconds only, and the best these are used in the neurosurgeries. Okay, neurosurgeries. Why it is used in the neurosurgery? Because it will be decreasing of the maximum intracranial tension will be decreased, and also epileptic action will be also decreased because this is a barbiturates. And what is the mechanism of the barbiturates? It will increase the duration, right? It will be increase the duration of the GABA, right? GABA, if ever you are increasing the GABA, it will be increasing the potent GABA modulation. The duration will be increasing. And next, in the neurosurgery, we will be using. Other than that, we can use this for the thyroid surgeries. We can use this for the thyroid surgery patients also, and we can even use this for the narco analysis. This is not the best agent, but still we can use for the narco analysis. And what is the metabolism, guys? Metabolism is by the liver. Okay, metabolism is by the liver, and there is no specific antidote that is present for this patient. And why? Because this is an enzyme inducer. This is an enzyme inducer. So since this is an enzyme inducer, it is contraindicated those who are suffering from the porphyrias. So porphyrias patients also, it is contraindicated. And onset of action is, as I said, this is less than 15 seconds only. And other conditions, you have to avoid the barbiturates. This is contraindicated in the patients of the asthma patients. Okay, we will be not giving in the patients of the asthma patients also, and also some of the cardiac diseases and shock patients, it will be not given. That is the common thing for the thiopentane. Next, another drug that we will be discussing, that is the most important one, that is the propofol. Okay, propofol. So what is the importance of the propofol? So propofol is belongs to the phenols group. Okay, the phenols group, this question is not asked guys, but just for the awareness you have to know. So this is belongs to the diisopropyl phenol, and these diisopropyl phenol also the onset which will be less than 15 seconds only. So this will be also having the less than 15 seconds, and highly this drug is lipid soluble. And how does it look like? It will be looking like a milky white color. Milky white color, why? Because it contains of the egg lecithin. Egg lecithin. If it is not white, then it is due to soybean oil. Next, why this drug is used commonly in the patients like daycare surgery that we are using? Because it has the recovery time. It has the recovery time 10 minutes only. So that's why we will be preferring this agent. And also it have antiemetic. This is the antiemetic, so aspiration will be decreased. Antipyretic, okay, so there is no itching also if we give this drug, but this drug is associated with the pain at the site of injection. Pain at the site of injection, that is present with the propofol of the drug. Okay, pain at the site will be seen with the propofol. And some of the other important points, this is contraindicated in the shock patients. This is contraindicated in the shock patients because it is having the some of the mechanisms such as sympathetic activity will be increased. I mean, the further it will be worsening of the shock that will be seen here. Next, the another property, it will be associated with the hallucinations. So it can be addicted also. Even the Michael Jackson is also died to addiction of the propofol. That is a point that you have to take note. So in which surgeries we will be using this? So surgeries that is used for the respiratory conditions. This is used for the respiratory conditions. Whoever is having the respiratory conditions like laryngospasm, bronchospasm, in those patients we can use this propofol. Like respiratory conditions also we can use these patients, and most of the daycare minor surgeries also we can use. This can be used for the patients, right? Next coming to the another drug we will be discussing, the four IV agents we will be discussing. That one is the ethomidate. So sorry with the spellings, just remember the drug name is the ethomidate. So this ethomidate drug is this is the cardio-selective drug. This is the cardio-selective drug. Why it is a cardio-selective drug, guys? Because it will be maintaining the cardiac activity. So this will be used for the cardio-stable drug, especially for the cardiac surgeries we can use this drug. But this is associated with the other types of the side effects. So this will increase the emesis. This will be increasing the chances of the epilepsy. So that's why it is contraindicated for the neurosurgeries. Okay, because aspiration can be seen in this patient, and it will be suppression of the adrenal activity. So adrenal activity will be suppressed in this. So this is also contraindicated in the adrenal conditions. Okay, adrenal conditions also we will be avoiding this. Only the best way we can use this is the in the patients of the cardioselective we can use this drug, right? Next, that is ketamine. So if you are all familiar with the Friends, so Friends, one of the Friends show, in the Friends show that the actor Chandler, right? So Chandler is Matthew Perry who is died with the overdose of the ketamine, and this is the NMDA blocker. This is the NMDA blocker. So it will be associated with the dissociative anesthesia. It's not the amnesia case, it is a dissociative anesthesia. Why this is occurring? This will be increasing of the catecholamines. So when the catecholamines in the body is increased, it is going to associate with the dissociated amnesia. Anesthesia will be seen in this patient, and most of the times it is used as a best analgesic. Okay, with the help of the IV we can use for the analgesic, and for the anesthesia we can prefer the IV more than the IM can be also used for this purposes. And also in the recent times it can be used for the chronic depression, and those who are addicted for the opioid tolerance. also can be used for this one, and this will increase everything: intracranial pressure, heart rate, BP, okay, IOP, all this will be increased in these patients. And what are the uses? Uses can be used for the shock patients. I can use this one, right, in the shock patient. And if the RR also increased, so I can use this in the asthma patients. Okay, asthma patients also I can use, and also COPD patients I can use, but contraindicated where ICP is increased. So in the trauma patients I am absolutely not going to use this one, and IOP is increased, so glaucoma patients also I am not going to use this one. H and the heart rate, BP is increasing, so patients those who are suffering from the MI or the cardiovascular disease also I'm not going to use this drug. So the uses will be only this, but the most of the unuses are more than this condition. Okay, this is the ketamine. So after the ketamine, the important points that you have to take note is the inhalation agents. Inhalational agents. So what is the importance of the inhalation agents? So inhalational agents are non-flammable. They are non-flammable, and the entry or elimination, let's say entry and elimination will be lungs only, right? This will be from the lungs only. That is the best thing. So the patients will be, the less time they will be having the condition that will be associated with the toxicity, because that is already evaporated. And how these drugs will be acting, this non-flammable only, but how they are coming into body with the help of the vapors. Okay, so the vapors, when we inhale into the lungs, it will be activated. These are the inhalational agents. But these inhalational agents have the some of the properties. What are those properties? So they have the second gas effect. So this question is asked, what is the second gas effect? Usually we are already taking via inhalation. With the inhalation, for example, let's say desflurane. Desflurane you add with the second gas. You add with the second gas. So that second gas is the N2O. So what happens here? So the quicker induction will be seen. So it will decrease the induction time if you add the second gas effect. Next, we have the Fmge effect. So we have the Fmge effect also. What is the Fmge effect, guys? Fmge effect means whenever the N2O is already have the diffusion more, so it is vice versa, it will be decreasing of the O2 concentration. So that will be causing of the hypoxia in the patients. This is known as a Fmge effect. Next, we also have the minimum alveolar concentration. This is minimum alveolar concentration. So what is this mean by the minimum alveolar concentration? Whenever you are giving the minimum amount of the agent, that has to stimulate the patients, right? So this minimum alveolar concentration, which will be known as a MAC, and this is inversely proportional to the potency of the drug. So that means the less potent drug will be having the high MAC, and vice versa. High potency of the drug will be having the minimum type. So how can you remember? So mnemonic, this drug is the Mahi is Dhoni, right? Mahendra Singh Dhoni. So these are the mnemonic. Mahi is Dhoni. So M for methoxyfluorine, and H for, this is for the halothane, and I for isoflurane, and this is the sevoflurane, this is the desflurane, and N2O. So let's write here methyl fluorine, and then halothane, next halothane, followed by the isoflurane and sevoflurane, desflurane, and then we have the N2O. This is how the pattern will be seen. Next, another also we have, that is the blood gas ratio. So if the drug is more in the blood, the less is the induction, right? So how this is will be presented? So the blood gas ratio you have to see. So this is completely opposite to the Mahendra Singh Dhoni. Okay, how? Let's see. So it will be having the maximum with the xenon, so maximum with the xenon, followed by the des, followed by the N2O for CO, then iso, halo, and then we have the methyl, right? Just opposite. Even if you forgot the into also, just opposite, right? Des, and that is how we are going to see. And you have to remember the points here, that is whichever is having the maximum MAC. So the maximum MAC, here we will be having the maximum MAC. That means it is less potent. And how about this side? So this is the highly potent but less MAC, that will be seen here in the methoxy. Next, coming to the blood gas ratio. This blood gas ratio. So the xenon will be consisting of the least blood gas ratio. So that means it will be highly induction. Highly induction. Next, this is less induction. It takes so much time, even with the second gas defect also, because it is having the high blood gas ratio. High blood gas ratio. So this question can be also asked in the MCQs. Points cannot be asked, but which having the highest, which having the lowest can be also asked, right? Next, moving on to the drugs and their mechanism of action, we will be seeing multiple. First, let's take the halothane. Let's take the halothane, followed by the isoflurane, okay, CO, desflurane, and sevoflurane. So they will be having the different kinds of the colors, guys. So these all the inhalational agents to avoid the confusion and the from the assistants in the, so we have the different colors. This is red color, and this is the purple color, this is purple color, and this is a blue color, this is the yellow color. Okay, yellow is most favorite for the so many people. That's why sevoflurane is used as a, most of the times the sevoflurane is used as a agent of the choice in the daycare surgeries, right? Next, coming to one by one actions, what we have to look after. So first and foremost, there is the CVS. Recently also the CVS question is asked about the halothane. Halothane will be decreasing of the BP. Halothane will be decreasing of the heart rate. So halothane can be done with the maximum heart rate decrease, maximum BP is decreasing, and also it can increase the arrhythmias. So the patient can develop the arrhythmias if you combine with the adrenaline. That is the one point that can be remembered. And next, coming to the isoflurane. Isoflurane can be given as a choice because it is does not change the heart rate, does not affect the BP. Okay, this can be given as an agent of choice. AOS means the agent of choice. Next, the desflurane can be increasing of the heart rate. This can be increasing of the heart rate, and the best one is the agent of the choice is the sevoflurane. Sevoflurane is good thing for everything. Next, CNS effects. CNS effects, everything will be increasing of the ICP. Okay, everything will be increasing of the ICP in the patients. But so something has to be used, right? Something can be used for the patients. In the most of the agents, we will be preferring of the this one, agent of the choice for the CNS. CNS can be used for this drug. But what is the difference when we are doing this drugs? We have to add the, so this can be also used, this can be also used, this is absolutely not used, okay, because it is having the maximum of the increasing of the intracranial pressure. So I will change the color. So this is not used, this can be used, this can be used, this is the agent of choice. So what happens here? How can we avoid this complication? So how can we avoid the complication? We have to increase the respiratory rate so that there will be decreasing of the EtCO2, right? If the EtCO2 is decreased, it will decrease the ICP. So we use this drug even though they increase the ICP, but we will be increasing the respiration and decreasing of the EtCO2, that will be decreased, further ICP will be decreased in this patient. Next, respiratory system. In the respiratory system, the best is here because it will be having the dilation. So this is the another agent of the choice for the asthma, especially asthma patients. This is agent of the choice, right? In this patients we can use. But why it is used? because it is also having the sweet smell. So the patient cannot get irritation for this. And this is contraindicated. This is also contraindicated. Why? Because it is having the very pungent smell, and this is irritant. This is an irritant. It can trigger the anaphylaxis also. So that's why it is an irritant. These two are avoided. But sometimes we can use the desflurane because it is having the very much quick recovery also seen in this patient, right? Sevoflurane is best choice that we can use. Next, GIT. In the GIT, what is the effects? GIT, this is completely contraindicated. H for halothine, H for hepatitis. H for halothine, H for hepatitis, because the blood circulation will be decreased in these patients. So that's why we will be avoiding this one. But agent of the choice, again we have to choose one, that is a sevoflurane. Sevoflurane is used. Remaining, we can use this one, second most common, and this is the third most common we can use for the agent of the choice for the GIT patients. Next, the last one, that is a nephrotoxicity. Okay, nephrotoxicity. So the maximum nephrotoxicity, this is absolutely contraindicated. This will be having the maximum nephrotoxicity. Okay, nephrotoxicity is used, and this is also decreased because it will decreasing the patients with the renal blood flow. So used isoflurane and the desflurane. Isoflurane and the desflurane can be used for the nephro patients, right? These are the important points that you have to remember for the inhalational agents. This is the points that is commonly asked in the examination. Next, moving on to the muscle relaxants. Muscle relaxants. So what is the importance of the muscle relaxants, guys? So muscle relaxants is used for the intubation. The only facilitation that we use for this is the ET intubation. This is only to facilitate the ET intubation. That is how we are going to use the muscle relaxants, right? So most of the times muscle relaxants have the two types, right? One is the depolarizing, and other one is the non-depolarizing, right? Depolarizing and then non-depolarizing. What is the example for the depolarizing? That is a succinylcholine. And the other drugs we have in these drugs are the mevocurium or the rocuronium. Let's take the example, rocuronium or the vocuronium. These of the drugs, curium drugs, are belongs to the non-depolarizing drugs, right? So what is the mechanism of the succinylcholine? Succinylcholine. So succinylcholine, which will be acting as a depolarizing agent. So this succinylcholine is best and effective whenever we are using for the patients of the ET intubation, or I can say this is used for the rapid intubation. Okay, so immediately if you want to intubate these patients immediately, that you can use the succinylcholine. So how this mechanism is going to occur? So succinylcholine is going to attach to the ACH alpha subunit. So it will be increasing the ACH activity. So what happens whenever you are increasing the ACH activity? So the more and more sodium influx will be seen. So once the more and more influx is seen, more and more contractions is seen. So the increased contractions. So once the contraction is increased, especially 30 seconds after that, so the sodium will be stopped. Okay, so it will close the sodium channels. So after closing the sodium channels, this will be causing the muscle relaxation. So facilitate us to proceed for the intubation. That is a mechanism for the succinylcholine. So first it will contract, then it will be going to release by closing the sodium channels. So these 2 points are important. So how it is going to cause sodium influx and muscle contractions, then sodium close, then the muscle relaxation will be seen with this one. Next important points of the succinylcholine that you have to know: how it is metabolized. It is metabolized in the liver with the help of what? With the help of the pseudocholinesterase. So you might have seen most of the theaters, we will be checking of the operation theaters, we will be knowing whether the patient is belong to the any specific community, because that specific community might have low levels of the pseudocholinesterase. So if the pseudocholinesterase is not present in the body, so it will be having the prolongation of the action is seen in this patient, and the duration is less than 10 minutes. It is the duration is less than 10 minutes. And what about the onset? It is just 30 to 45 seconds only. The onset of the drug will be to act, and it is a non-competitive. It is a non-competitive, and absolutely all the non-competitive drugs are irreversible. So we don't have any type of antidote for this. And so the most and common side effect that is associated with this is the malignant hyperthermia. So malignant hyperthermia, this question is also has been asking us continuously. So this is associated with the malignant hyperthermia. So what is the malignant hyperthermia? Most of the times this is due to ryanodine receptor is abnormal, or else it could be associated with a genetic condition, right? And even in the patients, those who are taking the succinylcholine drugs or inhalational agents. So these will be causing this condition. So what happens in the malignant hyperthermia patients? Sudden increase of the heart rate, sudden increase of the BP because of ryanodine receptor abnormality, and increase of the temperature. So all this sympathetic activity which will be causing of the muscle breakdown. Okay, muscle breakdown. So here the ryanodine receptor is activating more and more. This will be activating more and more. So the muscle breakdown is seen. So the ultimately the patient can land into the renal failure. So then what is the drug of the choice that we can use for this patient? So the drug of the choice for this patient is the dantrolene. Dantrolene has to be given for this patient, and IV fluids. This is how we can control the patients from the complication of the malignant hyperthermia. One point. Next, moving on to the depolarizing agents, right? We also have the depolarizing agents. In the depolarizing agents, you have to take note of the some of the important drugs only. So one among them is the depolarizing agents is the rocuronium. Okay, rocuronium. Why rocuronium is important? Because this is the agent of the choice for the daycare surgery. This is the agent of the choice for the daycare surgery. And why it is important? Because it is important for the rapid intubation. It will be help us in the rapid intubations, and it is also having the reversal agent. What is the reversal agent that we are going to use for these patients? That is the sugammadex. What is the mechanism of the sugammadex, guys? Sugammadex will be attached with this drug. For example, this is a drug. So this drug will attach with the rocuronium. So both will excrete through the renal. So this is the sugammadex. It is not a reversal agent of the acetylcholine, but it will be facilitating to remove the drug from our body. So that is what the sugammadex will be doing. Whatever the neostigmine, neostigmine will be stopping the action of the acetylcholinesterase enzyme. But the sugammadex is the best because it is just excreting the excess of these drugs from our body. Right. Next, we also have other group of the drugs. Those are the atracurium drugs. Atracurium drugs which will be intermediate acting, and these are some of the benzyl groups. And the most important point of the atracurium is it is going to go under the Hoffman's degradation. So the metabolism will be in the Hoffman's degradation. This Hoffman's degradation which will be depend on the pH and also for the temperature dependent. And along with that we also have the cis atracurium. If I have to use the atracurium or the cis atracurium, this agent of the choice will be used. Why? Because this will be having the less histamine release. So the histamine is not released from here, and also this is highly potent drug. So even with the low doses also it is highly potent. But atracurium is going to have the histamine levels which will be more and more elevated. So the patient might be having the anaphylaxis, right? To avoid this, we are going to avoid the atracurium drugs, right? These are the important points that you have to take note, guys. Next, moving on to the local anesthesia. Next point is about the local anesthesia. So what is important points of the local anesthesia that you have to take note? So first and foremost important of the local anesthesia, their mechanism of action. So the mechanism of the action will be they going to block the sodium channels. They are going to block the sodium channels, right? But it is highly associated with the pH pH dependent. This drug is highly pH dependent. And which form? This will be in the ionized form. Which will be in the ionized form. So for example, this is the cell. Inside cell pH is less, but the outside cell pH is high. So what this local anesthetic will do? So local anesthetic will be in the unionized form. This will be unionized form. So from the unionized form can only enter into the cell. So this is the active. Okay, this is in the active. So this unionized form which will be entering into the cell, and once it is entered, it will modify itself and act inside the cell. Okay, so that is how the effect will be seen. Once it is blocking the sodium channel with the help of the pH, it will be entering into the cell, and once the pH is lowered, so it will show it act. So that is what the important point about the local anesthetics. And we have the examples: amides and ethers. Amides and the ethers. And amides are mostly, these are liver metabolism, and these are the plasma metabolism, plasma esterases. Examples are mostly, you will be seeing that two kinds of ice will be seen. Okay, two kinds of the ice. For example, lignocaine, two ice, and these you are going to see procaine, only one I, procaine. And exception here, all are going to be from the plasma esterase except that is the cocaine. Cocaine is liver metabolism. Cocaine is by the liver metabolism. That is the one thing that you have to remember. And there also some of the important points that you have to remember with the this one is the side effects. Okay, what is the side effects that will be associated with the local anesthetics? Suddenly the CNS and the CVS and the patient is having the metabolic acidosis. Let's say if these three is presented after giving the local anesthetic, so this is the toxicity that is increased with the CNS, CVS and the metabolic acidosis. And what is the antidote that is given for this patient? Okay, the antidote that is given for this patient is the 20%, okay, 20% of the lipid emulsion, 20% of the lipid emulsion therapy is given. I written in the yellow color so that you can remember. So the 20% of the lipid emulsion therapy is given for this patient. And another side effects, this will be increasing of the methemoglobin. Methemoglobin is seen. Which drug is most common? That is the procaine and also benzocaine, that is most common. So this is also contraindicated whoever is having the hemolytic conditions. This is avoided. Even the patients of the anemia also, we are not going to give this drug, because it is going to cause the severe toxicity in those patients, right? Next, moving on to the important points that you have to take note, that is the epidural anesthesia and also subdural anesthesia. So let's see. So how you are going to give? First of all, you have to take note the part of the how you are going to this spinal anesthesia, the layers, that is important. So here the spinal anesthesia that is given. What is the site, guys? The best site for the adults. For the adults, it is L3 to L4, and for the children, it is L4 to L5. Okay, children it is L4 to L5, adults is a L3 to L5. So let's see what is the spinal anesthesia layers that is pierced one by one. So first skin, outermost layer, followed by the subcutaneous tissue, followed by the after that we will be having the supraspinatus ligament. This is the supraspinatus ligament. After the supraspinatus ligament, you will be entering into the interspinous ligament. And after the interspinous, this is the thickest layer that you are going to enter. This is the thickest layer, which is also known as a teres layer, also known as a ligamentum teres. So how can you remember? Sit. Okay, sit, SIT. So this is the flow, outer to inside. So after that you will be entering into the dura mater. Right? So this is how we are going to enter for the circulation. This is how, but they are contraindications, absolute so okay, let's continue here. So this is the spinal anesthesia, and until which point we will be giving the epidural anesthesia. So this is the end for the epidural. So here you are already reached the epidural, right? And here you will be reached the spinal. Here you reached the spinal anesthesia. 2 points that you have to remember. Next, coming to the needles. Needles, we have the different types of the needles that we have. So this is the dura cutting. This is the dura splitting. So which is best? This is the best. Why this is best? Because post headache is very much high, guys, in the dura cutting. So here the post headache is less, right? So the most common side effect also, that is the patients will be presenting with the hypotension, okay, followed by post-ductal headache that will be seen. Okay, post-dural headache will be seen in this patient, and this is how it is treated. That is important for us, how we can treat this patient. If the patient is having this condition, we'll tell the patient to take rest. If it is still not controlled, then we can give the patient IV fluids. Even if it is not controlled, then we can go for the caffeine supplements or the NSAIDs. Even though if it is not still it is not the patient is having the relief, then we can go for these patients to the blood patch. Epidural blood patch can be also given in the severe cases. Next, this question is last year asked. This is the Thuhais needle. Thuhais needle. This is used for the patients of the epidural, right? Epidural anesthesia that we are going to use. And what are the contraindications for the spinal anesthesia? If ever the patient is having the increased intracranial tension, you should not give. If ever the patient is having the increased heart rate and decreased BP, this is the shock conditions, you are not going to give this. And also the patients, those who are having the coagulation disorders, okay, coagulation disorders, you are not going to give. Increased CSF pressure, we are not going to give. And also the patient is having the low platelets, this is also severe to the bleeding, and here also we are not going to give. And the patient is unconscious, or the patient is non-responsive, okay, the patient is non-responsive, in this situation is not given. And also local infection, so local site infection also we are not going to give. This is how the contraindications of the particularly the spinal anesthesia is mentioned. The needles and these points is also important for the examination. So maximum we covered all the PYTs, guys. This PYTs is commonly asked in the all the previous year examination. So please do read this, and please, if you want to add, you can add some of the important points also, but you should revise all these important points, and so that you can maximum the 5 questions of the 5 questions you can easily answer in the final examination. All right, so those who are new to this channel, again, please subscribe to this channel, and also so do like the video, guys, so that it will reach the more students. And also watch the other videos also, all the other subjects also you can refer. And because this is going to help you, because I have put all my hard work into this, so that you guys can get the help for the final examination. So do watch other videos also and practice the Q bank is most important. Do the revision is important in the next 20 days. So until then, next video we will be seeing you guys. So happy preparation and happy, just take care of your health also. Health, take care is most important, okay, that is the most important that you have to take, especially time to time food and time to time sleep, that is important. So see you guys in the next video. Until then, happy preparation.